or if it's just going to be verbal presentations. Anne-Marie, can you help me with that?
Yep, everyone's just going to have a little chat. There are no slides for today.
Okay, so for those people who don't know, I mean, this is a great thing. There's too many of us to do individual introductions at this time because there's nearly 60 people, which would take up our whole hour. But what I should say is the people who've sort of initiated this, and we're in no way in charge of this, we just decided to try and see if there were other people working in the same areas as us. We're a group of researchers from Canada and Australia who have got together to start looking at this. So I'm going to host today, and my name is Arlene Astel. I'm a researcher at the University of Toronto, and I'm involved in a couple of projects, which you will hear a little bit about, which are looking at the experience of people when they get diagnosed with dementia in the workplace, and also the experience of employers who are supporting employees who get dementia while they're working. And so we have a number of other people from those two projects. So I don't know if we want to I think perhaps people will introduce themselves when they give a little update, and then we'll open it up for a bigger discussion. I'm not sure if we're going to go into breakout rooms or not. I think we were waiting to see numbers. Anne-Marie, are we doing breakouts this time?
No, I don't think so for today.
Okay. I just thought you'd be the whiz who was doing it if we were. Okay, so hopefully this will just be, like I said, it's like a little taster, a little bit of, you know, putting some morsels out there to really see where everybody else is doing work in this field. And we're so excited to meet all you wonderful people who've turned up. So hopefully this will be the start. 2022 is going to be the year that sees big strides in this field. So who is going, I don't have the list in front of me. Who's going first? Is it James, maybe?
Yep, I'm happy to go first. That's no problem.
Okay. Would you like to introduce yourself, James?
Sure. And I do have a couple of slides, so I'll just share the screen. You know, because I do. So my name's James. I'm a PhD student in Australia, and I'm working on this question of the experience of people with dementia or mild cognitive impairment at work, and thinking about how communications can be improved, and also you know, what kind of processes or policies could be in place to support that. So I've just put, can you see my screen? Yes.
Yeah.
So I've just put up a little schematic of some of the things I thought I'd just cover quickly. So the objective of this piece of research that I'm going to discuss was just to identify some of the problem areas in the experience of people with dementia or mild cognitive impairment, to look at some possible solutions, and to develop a communication or guidance approach for the different parties involved. And the research involved 4 groups. I looked at employers, HR and other employer supports, and also employees with dementia or mild cognitive impairment who either were still working or had left within 2 years. And then we also looked at some people who provided support to people with dementia, social workers and clinicians. In terms of what we found, or I came up with, is this kind of 4 boxes really, with a lot in them. Looked at the experience from the person with dementia's point of view, the organisation's response to them, the potential solutions or ways that we could deal with it, and then the progression from formal employment, which is really ultimately what happens. Individuals with dementia will obviously not be working for that much longer, but it's a question of how that's managed. And then I've got a couple of pictures here that just show some of the information behind these. So this one here is just showing the workplace experience, and this one here is to do with the potential solutions. And I'm just going to, I know that they're very big and messy and so on, but I've just put them on a separate slide just to show you what that kind of looks like. And So this is kind of like the sort of process or the experiential process that someone in a workplace might go through based on the qual that I did, and it's quite compatible with what's already been found as well. And you can see that people reminisce about what they could do versus what they can. There's also this issue of changes in ability. Sometimes people are aware of that, sometimes not. Certain dramatic triggering events, people attempting to compensate, a sense that, you know, I can't keep going. You know, there's sort of stories that people get told by their doctors and so on that, you know, their lives are just about over, which of course they're not. And then the loss of confidence and so on. But often find that people come to a place of understanding of their circumstances and what others think. And then this here is talking about some of the ways that this could be navigated. And awareness is obviously a key to it. And support from the various parties. At the moment, there really isn't that much knowledge or awareness of what's going on in organisations, and it's quite interesting to hear what some HR managers think is happening. And then basically the development of personal strategies for individuals. And then obviously there's a need for a certain amount of information and support to kind of underpin that. So that's kind of just a very, very quick flavour of the work that I'm in the middle of right now.
That's fantastic, James. Thank you. I'm sure that will chime with a number of people who are joining us, and hopefully will spark off some really interesting discussions about where research could. There's a lot of directions there. I think I'm going to tell you a little bit about the MCI at Work project, which is an international project between Canada, Sweden and Finland, which started in 2018, has been a bit elongated by the pandemic, as I'm sure we're all experiencing. And it's an interdisciplinary project bringing together occupational therapy, law specialists in law for aging and work, human rights and citizenship, psychology and engineering. So we've had quite a broad range of investigation, and it's been largely conducted through individual interviews with people in each country, and where possible, others involved in that situation, whether it's family members, colleagues, or human resources and occupational health, or managers. And there's, as you can imagine, each situation is very different. Some of the things that have come out of it, and I was thinking about this in terms of where are the emerging themes and directions for future research, and where also expanding across other countries would be really helpful. So some of the topics James just brought up about communication, for instance, and lack of awareness. And one of the things that we've seen is how, if people do get a diagnosis and they share it with, say, their line manager or occupational health, the stereotypes about dementia are incredibly powerful and can really influence what expectations there are of a person's ability to continue. And that's due to, where an area where there's more sort of education needed. But that issue around telling other people, involving other people around the communication, and because of different legislation in different countries, for instance, in Canada, people are not required to disclose a diagnosis. Of course, we know it takes them a very long time to get a diagnosis, at least 4 years in many countries. But also there's the impact on different, involving colleagues, or whether there's, space for other colleagues to even be involved to help them manage it. But some of the areas that we've looked at, which are perhaps more earlier stages, is people's ability to access and assert their human rights, to be involved in discussions about what happens to them, for planning their future. And that's really received much less attention. James mentioned a bit about the financial implications, and that's one of the things that's come through a lot in our interviews, especially people who are now out of the workplace, and what, not just the impact of losing your employment when you're possibly 10 or 20 or more years from your planned retirement age, but what you can access in terms of disability or other support. And we've also been looking at how technology plays a role. And it's a mixed picture, first of all, in that some people who use any sort of technology in their work, that can actually be one of the earliest signs that they note that they're having difficulties maybe using some new software or processes if they're doing any sort of thing that uses those sorts of services and devices, but also keeping up with things, keeping track of things. And so one of the pieces we've been doing is co-development of some prototype software to really support people through tasks. But obviously, we all know that there's so many different activities and occupations that developing something that will suit everybody is challenging. But we're trying to work through a co-design process to see how we can leverage technology to support people, and that to be part of the processes that can be put in place. So those are the areas that have really emerged for us, and hopefully there's other people here interested in one or more of those. I'm going to hand over to Anne-Marie, who is going to tell you. Yep.
Hi, so I'm Anne-Marie, and so one of our primary projects is to conduct a series of case studies with spotlight organizations. We want to partner with organizations that are interested in either taking a really proactive step towards creating a sustainable and inclusive workspace for people living with disabilities related to MCI and dementia, or we want to partner with organizations who have experience working with accommodating people who develop disabilities related to MCI and dementia. And so, as you can imagine, we've had quite the time trying to recruit organizations to be involved in these case studies. Due to the nature of the subject matter, the fact that, as you've heard from my colleagues, this process is often fraught with barriers and challenges, so the outcomes are often undesirable. So we have, through immense efforts, though, managed to partner with 2 organizations to date, and I want to take just a few minutes to quickly tell you about those organizations. So they're both large organizations. They employ anywhere from 24,000 to 100,000 employees across Canada. They are regulated by the federal government, so they are required to comply with our Canadian Accessibility Act. And one of these organizations also is home to one of the largest networks of employees working with disabilities in Canada. And so, despite the similarities, each of these case studies is taking a very different approach. On the one hand, one of our partners is interested in exploring how to proactively prepare and improve on their current policy and capacity to support people living with disabilities related to MCI and dementia. So at that organization, we're going to start by interviewing a range of employees, from supervisors to managers, HR administrators, C-suite executives, among others. And our hope is, depending on COVID restrictions on the ability to get into those organizations, is to do some field work and some archival work to be able to understand some of the education, policy, and their training materials that kind of speak to the corporate culture and things that might inform their approach to accommodation. And so our goals of these case studies is really to explore the attitudes and experience of employees at these organizations towards employees who have disabilities related to MCI and dementia. We want to be able to collect information about their management strategies, their policies, their culture that highlight the barriers or facilitators to being able to accommodate. And then we, as Arlene was mentioning, we really want to explore what tech, and by tech, I mean policies, software, hardware, it could be education and training, or the built environment at those organizations that could in fact be used to help employee support, or employers and support employees with such accommodations. And so, taking a similar approach with our other case study, we're actually working with a partner where we have the privilege of working with an employee who was at the supervisor level when they were first diagnosed with MCI. They worked for 2 more years, and then they were diagnosed with early onset dementia while on the job. And they were accommodated for another 2 years after that. And so at this case study, this is of course a best case scenario. It's a edge case. It doesn't happen very often, but we're working with that employee as well as their former managers, coworkers, et cetera, to explore how they navigated the disclosure process, subsequent accommodations, and again, all those same factors that might play in to what enabled this organization to support employees working with disabilities related to MCI and dementia. And so in both cases, we're working alongside some key employees at those organizations who are helping us identify factors that would really help those employees themselves improve their ability to provide sustainable and inclusive workspaces. And so our outputs are hopefully going to be aligned with what would actually improve their situation as well. And then we're hoping to be able to extract some data that'll finally shed light on the employer's perspective, because we know so much about what the employees are experiencing in this scenario and much less about what the employers need in order to support employees. And so that is kind of a little summary of our current studies on that.
Okay, thank you, Anne-Marie. And then I think, Josephine, you're going to talk a bit about AI.
Yeah. Thanks so much, Aline. Hi, everybody. First of all, I'm just going to start my 5 minutes so I don't go over. I'm Josephine McMurray, and I'm an associate prof at the Lazaridis School of Business. And I am one of the co-PIs on the grant that Anne-Marie was just talking about, which we have named Cog at Work, that's trying to get a bead on employers' perspectives about employees who are identified with mild cognitive impairment or dementia while they're still employed. And so one of the offshoots of this is that I'm working with two of my colleagues on a small side project that's looking at the use of AI and predictive analytics in disability management. And this sort of came out of our preliminary forays into speaking with people in human resources, and particularly in occupational health and disability management in different organizations. And there was some allusion to the fact that some HR departments and disability managers were in fact working with their insurance companies and their benefits holders, using some more advanced techniques to be able to manage disabilities within their organization. And of course, that makes a huge amount of sense. You have a lot of individualized situations, and when it comes to disability, N equals 1, everybody has to be, if they're going to be accommodated, will be accommodated in a bespoke way, so customized. So it's a perfect opportunity to use things like fuzzy logic theory and artificial intelligence to be able to mine large troves of data to look for patterns to see, is it possible to predict different types of disabilities. Once you have people in, can you use, as employees, can you use them, can you use the data that you collect as an employer to be able to look more intelligently at what type of work is appropriate for different people with different functional impairments? And so this project is really early on, so I don't have any wonderful slides like James has, but I just thought I'd just tell you a little bit about what we're doing. So we've done a lit review and just looked at the scientific literature at this point. And out of a trove of the literature that we found, we actually narrowed it down to just 19 articles. And most of them have been produced within the last since about 2019, not surprisingly. A lot of it is coming out of the USA and Canada. Much of it is coming out of engineering departments, where and the rest of it is coming out of occupational health and rehabilitation types of journals. And much of the work is being done related to machine learning algorithms that are being applied to large public databases, or to the use of robotics in order to be able to manage the disability process once people are actually on the job, so assisting them with return to work. So across that disability management, from identifying that somebody actually is eligible for disability management and then managing it as they're returning to work after either an occupational or non-occupational injury, and helping them to stay on the job, that's kind of the journey that we were looking at for disability management. So a very small, scant set of literature in this area around smart technology or smarter intelligent systems that are being created to be able to help that process. Interestingly enough, there is a lot of work that's being done, as many of you will probably know, in the use of AI for recruiting and for hiring. So we're interested to see that it's just, researchers are just starting to look at this whole disability management process, which is kind of underpinning our COG at Work project, which is looking at, what are employers' perspectives when they're looking at people who are identified as having some sort of disability. So that is a project we're about to do. We've got about 15 folks lined up to do industry interviews as well. We've reached out to some really interesting people in HR and disability management and not-for-profit organizations, as well as two insurance companies who have stepped forward and said they'd be willing to speak with us. So we're hoping to get what is not out there, which is in sort of the gray literature. There's not a lot about this usage. People are being very closed about what they're actually doing. So we're hoping to get some insight, and that's my 5 minutes. Thanks.
Thank you very much, Josephine. Well, hopefully, so those introductions to some of the work that's going on in Canada and Australia and other countries will chime with some people. What we'd love to hear from, now we've sort of set the scene, to hear from some other people of other projects that they're doing or areas they're interested in, and then we'll try and focus it. I think Philip is going to sort of guide this discussion a bit in terms of looking at potential areas for collaboration. And I know there's people on the call who are not just researchers, but I think that's absolutely brilliant, because really this is a multi-perspective, multifaceted issue. And so building new collaborative groups to look at the issues that emerge should really be involving as many of the different groups as possible. So Philip, would you like to introduce yourself?
I shall. Philip Taylor from Melbourne in Australia. Hello, everyone. And some of you, I recall, were on the call last time, so hello again. There's some new people. I see James Appleby here. Hello, James. And some North American, other North American friends. So it's great to see so many people here today. So I think really picking up what Arlene said, we didn't want to, the Canadians and the Australians didn't want to hog the floor, so to speak. It would be very interesting at this point to hear from anyone about any research that they're presently undertaking, or if any of you can get straight to seeing common themes and threads amongst the various fantastic presentations we've had this morning, which might lead us to move into a discussion about collaborations and funding. So first of all, any burning research that anyone would like to tell us about? And just feel free to dive in, anyone, or if you have any comments on any of the presentations or indeed any questions. Who would like to go first? Angie, you got your hand up?
I did, yes. Hello. Hi, this is all very exciting. One thing that I saw sort of a thread through all the presentations, and something that I think is sort of sparked in my interest is thinking about from either the employer or the employee side, the need for how the law sort of intersects in these different spaces as a protection or potentially an obstacle. So I'm thinking from the United States, we have all of these protections for, disability laws, reasonable accommodations, and I'm thinking of collaborations and beyond, like how could we think about, invoking the law as a way to, like, thinking about even AI, how is that potentially a tool for employers to use, and protecting employees' rights, or how could it be an obstacle? And I could see that thread in all the presentations. So I would love to hear more from others if you've thought about that, or if you have partnerships, if that's part of the interdisciplinary teams. Okay, thank you.
Fantastic point, Angie. Thank you very much. I don't know if any of our colleagues would like to come back on Angie's comment. Anything resonate with anyone? Josephine, did you want to come in?
Yeah, happy to chime in. And Angie, so the Cognitive Work team, and by the way, we haven't introduced, but Jen Boger and Catherine Burns, I believe, are on the call as well. So Aline, Jan, Catherine, and Anne-Marie and I are on this little project. And we have actually done a policy review and looked at this issue across the world, and so has Aline and her group with the MCI, the international team. One of the things that is absolutely clear is that that there are hurdles that are presented in law for employers to have to meet when it comes to accommodating an employee with a disability. So I think across most of the Western democracies, there are, like the AODA or the Accessible Canada Act, and depending on your country, there are different state laws or provincial laws as well as federal laws, which kind of intersect at times. And so we have actually looked at that. One of the things that I would say is that we actually did a jurisdictional review as well to look at what jurisprudence looks like in Canada for people who have not been able to negotiate individually with their employer, and where their cases have actually gone to court. And the issue around what is undue hardship for an employer is something which is very variable based on a huge number of factors like size and industry and age of employee, etc. But ultimately, as long as an employer has gone through the accommodation process, and if it has been unsuccessful, then as long as they provide an employee with an appropriate notice, then they have a lot of power. And so I think this is the reason why we feel really strongly about the fact that working with employers who are committed to diversity, either because of the laws or the sector that they're in, so have a strategic commitment to diversity and are big enough to be able to accommodate some of the costs that go along with some of those the diversity that comes with, for instance, cognitive or neurologic diversity, that if we can get out there and work with those folks to be able to have some experience and find out as well those organizations who have found pathways where they are happy and the employee is happy and has been able to either work or leave with dignity, I think that's where we're trying to go, because our sense is that the law can only go so far. And I'll let my colleagues jump in.
Thanks, Josephine. Yes, does anyone else want to comment?
No, I was just thinking it would be good to hear if anybody else has been looking at this issue or got insights from not a research perspective necessarily, but experience or practice perspective.
Thanks, Arlene. Yes, would anyone else like to comment at this point? Josephine, you still got your hand up? Thank you. Anyone else at this point? Sorry, so James. Hi.
James Appleby here with the GSA team. First of all, I want to say thank you to all the presenters and congratulations to you on all the work you're doing here. I mean, this in many ways is the issue of our time, isn't it? Trying to figure out how we are as a society going to help support individuals developing cognitive impairment and dementia as they progress through the life course. And this topic I find to be absolutely essential conversation to have. So I'm so glad that you're having this conversation. It did come up on a call in December, I recall. The Milken Institute has an alliance for dementia. And this is one of the issues that came up, that people were expressing, hey, when it's determined or discovered that someone has dementia, their employer typically, finds a way to have them separated from the team, and it causes enormous hardship. And so I think figuring out what the ongoing research agenda is, and I think each of you have put forward compelling topics that have to be sorted out, and this issue of the law also is something that has to be worked through. So I would just say I'm glad we're having the conversation, and it's absolutely essential that we find a way to support these individuals. The stigma that goes along with it, being so extraordinary, and I would just say that when you think about other conditions that individuals develop as they age, it also affects their work performance. If someone, depending on what the illness is, it affects their work performance. It's not as though dementia or cognitive impairment is the only thing that affects someone's performance at work. Other illnesses do as well. So I think we should be thinking of them as existing on a continuum as we're continuing to explore what solutions might look like. But the legal issues clearly are a big challenge, and I'm delighted to hear that you found employers that even want to have the conversation. I think that's a really big leap forward. Thank you.
Thank you very much for those comments, James. Very well made. Jennifer, did you want to comment?
Yeah, I just wanted to follow up. That's exactly sort of what we're finding, and I think employers are they're not there yet, but they're starting to become more and more open to the conversations as more pressure is put on people to have socially just organizations. So, I think the time is right to start finding those kind of people who are more willing to start figuring out what's going on in their organization, as well as where they can do better, where the opportunities lie. So I think that's a really great point. And to your other point too, I agree entirely, is, it's usually not just one thing, and, it's one thing alone. We have to look at the entire context and what other factors might be in play, which makes it very complicated, especially, and we said this before, things like dementia, especially when it's earlier onset, often get mistaken for other things like depression, like substance abuse, stress, burnout, all these things. But it doesn't mean that those things aren't happening too, because of the dementia. Then people might be actually, those things might also become true because of a lot of the stress and other things, and just pathology that goes along with it. So I think those are really great points, and it really underscores, I think, why we really need a strong multidisciplinary approach to these types of problems, so we can start getting the bigger picture. I think that's one reason why we've been so delayed on this field as well, is it's very complicated. It's hard to get people to talk about it, and the problem itself is extremely complicated. So everyone just is kind of like, so that's something I'd love to see come out of today's kind of discussion, is people, starting to say, oh, I'm interested in this sort of angle, and this is my expertise. So we can start looking at where are the opportunities to work on problems together with people who are interested in the same sort of issues.
Thank you very much for those comments, Jennifer. I thought I'm conscious of the time, and I can see that Barb has her hand up. Barb, did you want to comment?
Thanks, Philip. I just had a really quick question. This is just also fascinating, and James, I couldn't agree with you more. This is such a relevant topic, because we are an aging society, and I just do have that fear that this is just going to mushroom in our workforce. And so I am just so grateful to all of you that are doing the research out there. It's just beyond needed, and I'm really grateful. I'm curious if anybody is has isolated women in the workforce developing dementia, because we live longer on average typically. And is there anything special going on there?
Thank you. It's a really good question. Did any of our colleagues wish to comment? Any literature with which anyone's familiar?
I was just going to say, I think no, sorry, I don't have the answer to that, although I know that from the interviews, there may potentially be different experiences for men and women when this is happening. But I was just thinking, I know other people, they've been very shy and bashful because I can't see them, but I'm sure some of the other people who we spoke with last time were mentioning different pieces of work around different groups in different countries. So then we want to emphasize this is really for anybody to join in. If you've got anything to add, please do. Please just, this is for us to get together and see where we can take this forward.
Thanks, Arlene. And I think yeah, at that point, I think that's a very good segue into a wider discussion. Just to start the discussion, the intention with the Australian and Canadian teams coming together was always to look for opportunities to network, but critically to build a research agenda, research program. And we being very keen to be inclusive and to want to involve others in a dialogue about putting a program of work together. And so at this point, and we got to about 20 minutes left, I just wanted to throw the floor open for a further discussion about opportunities to take our collaboration forward, stressing that there's never been any intention for this to be exclusively Canadian Australian. We are very keen to reach out to others to look for potential opportunities to work together. So it's always been our determination that we'll ultimately achieve grants or a grant to be able to do work. So did anyone at this point want to come in with any ideas or any thoughts on those topics?
Philip, my only thought is perhaps this group could get together to indeed put together sort of the research agenda, something of the top 10 questions that need to be answered, perhaps identifying some of the external partners that have to be brought into the conversation, whether it's legal societies or groups that represent employers or something like that. But maybe putting forward what the research agenda ought to be would be an important first step to help guide collaboration, and we could find a way to get it published. Is sort of what my thinking is.
Thank you, James. Is it public policy and aging report sprang to mind immediately?
Yeah, perhaps, or perhaps another GSA journal or something. I mean, this is it's an important issue, and I think there'll be opportunities to get it out into the peer-reviewed literature in order to push the conversation out and to bring more people into the research.
I think that's a great idea, James. Thank you very much. Note that. So thank you. Would anyone like to respond to James's comments or add additional comments at this point? And I should stress that the intention is to be inclusive and to involve people in a genuine discussion about where we might go as a group. And I'm assuming, because you're present here today, that you're interested in joining a network. So that's I think our expectation that you'd want to participate going forward. So does anyone have any additional thoughts or ideas? Feel free to speak. Please.
I was going to propose, Philip, that perhaps people who've been listening would like to, even 10 seconds, just come on camera and tell us where they are and what their interest is in this topic. This is, this is meant to be the first kickoff for getting together. So please make the most of it and just share why you're here. I know I get my students to do this at the first meeting just to say why they're interested. So please, we're quite friendly. So please,
yes,
do you want to invite people, Philip? You want to just?
We are very friendly. Well, I think rather than putting people on the spot, would any of you just like to speak up at this point and add your own thoughts, whatever they might be? Sure. With my students, I always hate putting them on the spot, particularly in the first class. So.
Looks like Lori has a comment. I thought Josephine had her hand up as well.
Pardon.
Sure. So my name's Lori Martin Plank. Although I am PhD prepared, my primary position is as a clinical faculty member and a geriatric nurse practitioner. So I'm interested in it from that standpoint, and also because I think in North America, we are a very ageist society, and whether people have dementia or not, they are trying to ease older adults out of the workplace into the gloom and doom of retirement. And so I'm interested from that standpoint. Thank you.
Thank you very much, Laurie. Important points. And would anyone else like to add a comment? Oh, I was going to break my rule and ask Christine if she wanted to comment. Christine, did you want to come in?
Sure, Philip. It's good to see you. It's been a while since SGS. I'm in Williamsburg, Virginia, and I'm with a health system and a center that focuses on aging and a lot of memory care support. And so actually my interest was trying to support our own team members who are caring for loved ones with memory loss. So you all are looking at the employee, in this case, in a healthcare system in my setting, who may have memory loss themselves. So thank you for kind of exposing me to that, because my initial interest is how we estimate that 20% of our 10,000 members in our healthcare system are caring for an older relative in addition to their duties that they do here in the health system professionally. So we can't afford to let any of them leave. And so we're trying to support them when they're on the job and when they're at home, because they're still at a job, and they become the default caregiver. So, but thank you, because as I work with HR to try to support these employees, I also need to help them be aware that there could be concerns with memory or maintaining one's job duties, as particularly an early memory loss might become apparent. So thank you for exposing me to that today.
Thanks for those comments, Christine. Very well made. Anyone else wish to comment at this point? Feel free. Can I call Jennifer out? Jennifer Heston Mullins. I know. I think Jennifer. Hi. Did you have anything you would like to add?
Not anything specific at the moment. I think the topic is really interesting. It's one that we're just starting to think about. We've been doing some research in regards to caregiving in dementia, and we've had the opportunity to speak to some individuals recently in our work that were living with dementia. And so this topic of employment and some of this we're just starting to delve into. So I wanted to hear a little bit more about what others were doing in this area.
Fantastic. Thank you very much for that. And maybe a question to the floor. People are attending, no doubt, for a range of reasons, but amongst colleagues, is there enthusiasm for the idea? I like James's idea of putting an agenda together, but building on that to put together some kind of network where we might see funding opportunities. Is there enthusiasm amongst people for that kind of idea?
Josephine has a comment.
Oh, I beg your pardon, James. Thank you for that, because I'm not seeing things coming up. So please, Josephine.
one of the things that we might consider doing, and given that we are all so used to being remote, this might be something that is of interest to people, given that we're so geographically dispersed, is one of the granting agents here agency here in Canada actually has grants that allows us to put on conferences or to be able to connect with other people. And one of the thoughts that we have had as a group in the past is actually doing a conference with some, and by conference, that's very small C conference, with some presentations from people who are doing work in the area, and then looking at either doing a special issue or an edited book that would sort of start to consolidate some thinking, would bring some people together so that they were working together in a less formal way to start with. And if that did actually take off, allow us to think about, looking for larger grants that might build a network with multiple pillars of interest. So I guess what I just wanted to sort of throw out there to maybe generate some discussion is this idea about something small with an output that folks could be involved with and could start to establish some of these some of the connections between people in this group. Thanks.
Small baby steps, Josephine. I think that's a good idea. Does that resonate with colleagues? Does anyone have any comments on that suggestion?
I really like that idea, Josephine, and I could imagine even a small C conference, as you say, perhaps via webinar, where we could invite perhaps probably a representative from Society of Human Resource Management. I know Philip's very connected in with that organization, I believe, and perhaps again someone from the legal field. I noted that one individual who had to sign off has a legal background as well as social work as well, Angie Perone. Giving some different perspectives on this, I think could be a very drama-filled conversation, shall we say, as well. That could be part of a small C conference. So I think steps like that would be wonderful if we could move forward in that direction.
Thank you, James. Just maybe I can add a little bit. I also, as well as being located in Australia, I also wear a British hat, and I have an association with the University of Warwick. And I know that one of those unfortunate things of timing, a major funding opportunity came up recently from the Economic and Social Research Council in the UK. And it was very unfortunate because I felt it would fit what we're talking about perfectly, but we missed the opportunity by a week. But I'm certain that that opportunity will come up again. So what I can do is send some details about the opportunity as it was, because I think it'll be repeated. And maybe we could begin to start looking for, that kind of grant opportunity. As I recall, there was the potential for it to involve international partners. I was immediately very excited by that opportunity, but then we realized that the closing date was just too soon to put something together. So I think there are relevant granting opportunities out there, and I'd be very keen to pursue them with you. I'm noting that we've got about 5 minutes left. Do we have any additional thoughts, comments at this point? I know one or two people have not yet had the opportunity to speak. So did anyone wish to comment at this point? Okay, well.
Hello?
Yes, please, go ahead.
I'm sorry, I was trying to find the button to raise my hand and I just couldn't find it in time.
Please go ahead.
I'm Maria Rochdean, and I'm a nurse by training, and also a novice researcher. But so one of the things that I have been looking at, I've been looking at dementia, but given that, at least my thinking, my interest in participating today was the average age of a nurse is still 45 years old. And we've had a lot of nurses leave due to the pandemic. So I'm a little worried in terms of what can we do to retain the current nurses that we have, and knowing that, of course, cognitive impairment can, show up early on. I'm interested in finding out what are some of the groups that you guys have been working with in terms of looking at MCI, and how you've been able to work with these organizations to retain the staff who are experiencing a mild cognitive impairment. And so just to figure out like what could be replicated for nurses also, or other healthcare providers, knowing that we're experiencing a worldwide shortage of this population right now.
Thank you very much. A really important point, Maria. Just wonder quickly if any colleagues would like to respond to Maria's question. Particular occupational groups. Did anyone wish to say anything?
No, I wasn't going to respond to that particularly, but what I was thinking, because I know we're getting towards the end, but I was really thinking about the sort of format of these meetings going forward. And I was just going to say, like, we've had some specific topics and issues come up, and whilst on the hoof we may not necessarily have all the answers, but they could be topics for discussions. Like we could have future meetings, could be around certain topics like the legal elements, or what we're just saying about resources and supporting people, because that's come up. And I just wondered if it's possible for people to do, if they can find that raise hand, but like a show of hands of, would you be interested if we have regular meetings and some might be topic focused, for instance, about supporting people in the workplace and resources, or how, sharing our experience and practice. Is that an approach people would be interested in? If you can use the hand button or put your hand up, just so we can get a sense of how to organize this to maximize people's time. Yeah, looks like. So we can take, because from the transcript, we'll be able to identify some of these topics, and some can be, doesn't have to be all a research focus, although that's always the evidence base will come through it, but it's more so we can have these structured discussions. Yeah, okay, thank you. Sorry, I'm butting you, Philip, but I was just thinking,
no, it's all right.
To get a sense of what we do next.
Actually, I was just about to go there, but no, I appreciate that, Arlene. Thank you very much. And I know that time is drawing to a close, and I think it's a good point to end on, Arlene. I think we're keen to continue the dialogue with you all, and so if any of you have suggestions as to topics of future meetings, that would be fantastic. We want to continue these meetings through 2022 and beyond. Hopefully, in the relatively near future, we will be able to hear from Louise, who very unfortunately was unable to join us today. I think probably at this point, I can see it's 7:59 a.m. Here in Melbourne. I think we should draw things to a close. Can I end by thanking you so much for finding the time in your busy schedules to join us today. Do come back to us if you have any specific ideas about future meetings. We'll be back in touch with you. And if you have any thoughts about potential collaborations or funding opportunities, anything of that ilk, please do get in touch. It's our sincere intention to be inclusive around this, and so we very much want to reach out and collaborate with people. So at 8 o'clock in Melbourne, I'm going to draw a close. Thank you once again. Have a very nice evening, those of you in North America, and have a very good day, those of you joining us from elsewhere. Thanks once again.
Thanks, Philip.
Bye all.
Yeah.
Thank you.
Thank you. Bye-bye.
Bye.